Hi, it's Dr. Aaron Gum, founder of Blueprint to Practice Automation, yourautomatedpractice.com. Today I'm going to talk to you about neuropathy, our Blueprint to Neuropathy program. So when you talk about neuropathy, if you look at the other models and the other systems out there and the other clinical protocols, you have a lot of pain points, what I call them. You got time, a lot of time required in the office, a lot of time taking patients through the process, a lot of time educating patients. And you have congestion. Congestion is attached to all the stations you have set up into your office. Some of these visits are, hour, 2 hours long, and these patients are going to having to come in 3 times a week for 24 visits to 36 visits over a 90-day period of time. Then we start talking about clinical results, okay? So are you using, or are other people using the right equipment, the right technology, the right researched processes to get the clinical result that you want? Because obviously that's the name of the game. In the end, are patients getting better, and are you adding extreme value in the program? So when we look at the Blueprint to Neuropathy program, we use a hybrid model. So what I mean by hybrid doesn't mean that we're using some insurance, some cash. It's actually hybrid between home care and in-clinic care. 75% of the treatments are done at home, 25% are done in the clinic. Our process has 21 peer-reviewed studies behind it, some of the technology that we have. 97% success rate, okay? So that's huge. Knowing that you have a process where you have a 97% success of getting good results with a patient with neuropathy, that's in itself worth it in general. So when we start thinking about, when we look at the clinical process, the clinical program, we have 75% at home. They're doing an infrared product at home. They're doing a stimulation device that re-educates the nerve at home. And then in clinic, they're doing, everyone's a little different in clinic. So we have medical doctors, naturopaths, chiropractors, acupuncturists. We have a dentist in our program. We have over 250 clients across the country, depending on when you watch this, if you're watching it now or watching it later. So the in-clinic protocol is going to be a little different. We're going to help you put that together. You don't have to go buy $30,000 laser or a very expensive PENF devices. Those are great technologies. If you have them, we will definitely put them into your in-clinic protocol and leverage them to the max so you can create extreme value for your clients and for your patients. So that one time a week is going to go for 90 days. Sometimes doctors are seeing them once a week for 2 months and then twice a month that last month. That's something that we'll work out. That comes down to semantics. So also included in that protocol is a nutrition support process that we put the patient through because the whole program, we're trying to increase nitric oxide, decrease inflammation, create alkalinity, and empower the patient to make lifestyle changes along the way to add added benefit to their program. So that nutrition kit, we have you probably heard L-arginine is a great nitric oxide producer. Well, we use the new research around L-citrulline and combined with a few different other components that create nitric oxide in the blood 3 times as long as L-arginine, okay? We have an inflammation product, alkalinity product, and so forth. So that patient's gonna get a nutrition kit, home care, in-clinic care once a week, and they're gonna get online education that's automated. So you're gonna enroll them into our super-powered software that educates that patient about that niche the entire time. They're gonna get a recipe of the day. They'll have seminars online to attend. They'll have tips on wellness tips of the day. And also, they can send virtual messages, and don't be worried if you have a patient that doesn't have a phone, doesn't have an iPad or a laptop or even internet in general. We have a printable version for them to go through. So the last thing I want to talk about are systems, okay? Most neuropathy programs have 0 systems. They're convoluted, they're congested, they create confusion, they get lackluster results in the end, and by the time, if you do even get results, it's almost not worth it from all the trouble you had to go through to get that person qualified in the program and servicing all the things, all the moving parts in the clinic. So systems are important. So a couple things we do with the home care, we have a drop ship model. We have negotiated prices for our clients. They drop ship the equipment straight to the patient's house. You don't have to hold any stock in your clinic, which is phenomenal. You can use that money for marketing, so you're not buying anything until someone pays you. So this is a setup that we have that's exclusive across the country. Drop ship it straight to the patient's house, and they can start doing their home care immediately. And then we have to have pre-education systems. Pre-education systems, we have the automated seminar, which is a video, okay? We have, again, over 250 clients using this. The video is phenomenal. We teach you how to do the introduction to it, how to close it out. You can do live seminars with the video. You can do one-on-one pre-consultation format with the video, because now you don't have to worry about getting those people to the seminar, and if they don't show up to the seminar, they're not going to be pre-educated properly. Now you have an option and a tool to plug them into consultation to be pre-educated in a consultation format as well. So you have two different options now. And I have a lot of clinics that have staff run this entire process, okay? So the doctor doesn't even see the patient until they go through this pre-education process. And then another thing, on day 2, patient comes back. Now you got to sit down and talk about, the concepts and give them analogies of what we're trying to accomplish. Tie it in with the pre-education. Instead of you spending your time and energy with all these things, we have the automated report of findings as well. Patients plugged into it, short 12 minutes. By the end of that, they understand exactly what we're going to be doing, what we're trying to accomplish. Doctor steps in, goes over the program, gets them signed up. They're only in there 5 to 10 minute max, and then they enroll them into the online education, drop ship everything once they become a patient. So the systems are there, okay? So the automation is there. So the key is all the pre-education that they need to go through, and also the education they need to be having during the program to keep them engaged, to keep them excited about the program. So recap. So we have the dropship model with the home care. We have the nutrition care, okay? That can be dropshipped as well. We have the in-clinic care, which will teach you. You may be doing a lot of great things already. We'll give you our 2 cents and we'll come down to a final in-clinic protocol. And then we have all the automated pre-education that's going to save you a lot of time, a lot of energy. It's going to increase your collections and increase your sign rate because you've taken a patient through an efficient process that's reproducible, that's not needed. The doctor doesn't need to be part of that. Staff can run it, and it ends up, we're all winners in the end. So remember that. You got to look at systems. That's how we operate. We have a very efficient hybrid model that's going to save you extreme time and energy while increasing your collections while you're working less. Who doesn't want to do that? So hope you enjoyed this video. We'll talk to you soon. God bless, and have a good day.